either in nonprofit or for the profit sector, he has stayed committed to caring for the most medically underserved. He now leads UCI Health Family Health Centers as the executive director, and throughout this pandemic, he has become a voice and a leader for the Latinx community, appearing on programs like Univision and Telemundo, various Spanish and English newspapers, as well as other news outlets. It is with my pleasure that I introduce Dr. Jose Mayorga.
Thank you, everybody. It's a pleasure to be with you all. I'm excited to have been given the opportunity. It's kind of it's great to come full circle. This is exactly where I thought I would be at some point in my career, getting the opportunity to not only educate undergraduates, graduates, anyone that would listen, but also give the opportunity to give back to the university that gave me so much. Obviously, you heard I went to undergrad and medical school here, but the education was just one component of what the university gave me. I learned so much more being part of various organizations, and so I absolutely jumped at the chance when the team asked me to participate today. So what we're going to do is going to walk through for a few minutes on a couple of topics that I think are really important throughout this pandemic. The other thing I'm going to make sure we do is leave time for questions, so I would be happy to answer as many as I can, especially around the vaccine. I think there's a lot of questions that have already come in through in preparation for today, and so I definitely want to answer those, and of course, whoever wants to ask me questions during this time. I suspect there's going to be some things that jog your memory or you want to ask more about. So what I'm about to do is I'm going to share my screen. If the team could allow me to share the screen, that would be great. I think right now I'm not able to do that, but as soon as they give me permission, I'll be able to share. And so I think while we're transitioning here, I think it's an important time, right? I mean, we've officially have a 1-year anniversary of this pandemic, and really understanding, where are we at? What's this vaccine all about? And really, has this pandemic impacted certain individuals more than others? So a lot of what we're going to talk about may not necessarily be new, but I'm hoping that it stirs a little bit more, motivation, excitement to want to say, yes, I want to help support however I can in educating not only myself, my family, my loved ones, but also my community. So why don't we go ahead and get started? So there we go. So where are we now? Where are we now? So as of last Friday, unfortunately, we were at about 119 cases of this infection across the entire world. Death-wise, we're over 2.6 million. And unfortunately, the United States holds the top position in both these categories with number of cases and deaths. And we have to really take a step back when we look at these numbers. Let's not forget that there was a lot of time when we didn't test many people. People opted not to test themselves. And I will tell you that I am sure there's people right at this moment in time that haven't gone and tested. So these numbers are probably conservative and underreported. It is likely that there has been more cases and more deaths. We just haven't been able to document them simply because people have not gone. And so when you look at the overall cases in the United States, we always talked about waves and surges. And so we knew as experts that there was potential to have multiple surges during this pandemic. This is the things that a lot of us studied in medical school and even in undergrad, that there will be a pandemic at some point. And here we are living and seeing it. So the first wave, you can see there, which is around summertime, we knew that this was likely to hit us again in the winter given the patterns of this infection. And that wave was going to be about 2 to 3 times bigger than the summer. And true to form, it held that. And unfortunately, more people lost their lives. At this point in time, we're still seeing the number of cases per day being reported as well as deaths. So approximately about 1,500 people a day are still dying from this infection. So just kind of keep that in perspective. Even though we're hearing a lot of great things that we're coming and making a turn, there's still a lot of cases being documented across the country and, of course, death. So Really, when you look at the United States in particular and look at specific counties, the top 10 counties with cases documented, unfortunately, reside here in Southern California. Every single county in Southern California makes the top 10 list. And I think this is also really humbling because, if you think about the entire country, a lot of folks that live in specific counties are being impacted more than others. And here in Southern California, think about the demographics that live in these various counties and the likelihood of who is getting sick and who's really succumbing to this infection. So, closer to home, this is Orange County data that the Orange County Healthcare Agency puts out. Of course, you could kind of see the waves that line, the summer waves and now the second wave that occurred. Numbers are coming down. There was all this really concern about intensive care unit capabilities, hospitals being at the brinks. UCI Health in particular put a lot of effort to address a lot of those needs. As the only academic institution in the county, it was our role and it was frankly our duty to want to respond to the entire community because we know we have the experts, we have the skill sets, and the ability to take care of all the county. And so many of you may have heard and seen that we even opened up a mobile field hospital. This is stuff you see in the movies. Like people actually put out huge tents that allowed our capacity to expand. In a matter of a few weeks, a matter of less than 3 weeks, we expanded our bed capacity in the hospital by over 120 beds. And so that just kind of gives you some perspective of how intense this pandemic has been. And yes, we've come out of it and we're looking a little bit better now. There's still some concern that we have as we continue to move through the next few months. So what about now this vaccine, right? Dr. Fauci and everyone about a year ago was talking about we were going to have a vaccine within a matter of a year, and here we are. This is data of all the vaccinations that have occurred across various countries. In the United States, this is definitely the place we want to be. We want to be at the top of the list. We've vaccinated over 70 million people. Just this past weekend, there was 5 million people vaccinated, so that's absolutely amazing. Someone got a needle in their arm, and you've probably been hearing a lot about how many people we hope to get the vaccine to in order to achieve what's known as herd immunity. So we'll talk about that, and definitely if you have more questions, we could explore that a bit more. And so really as the pandemic has kind of evolved, there's different things that have occurred. So let's think back, if we could think back about, a year ago. The first few cases, particularly here in Orange County, were documented in affluent cities. There were actual cases that were being documented because we suspected these individuals contracted it from traveling abroad. And so as I reflect on that a bit more people early on were getting tested who had the resources and the means. And so those individuals had health coverage. They would be able to find somewhere to get tested at. And all the while, we knew that there was a likelihood that this infection was circulating a lot sooner than was originally documented. We suspect in California it was actually circulating at some point in December. But again, we just didn't have the capacity, nor were we encouraging folks to get tested at that point in time. And so really, as I get more and more into this, there's particular communities that have been dramatically impacted. And what this pandemic has demonstrated more than anything else is our healthcare disparities that dramatically impact poor communities, communities of color, and their lack of access to healthcare. I think that's a really important point because we are living and breathing the challenges our health system in the United States faces, and I really hope you, along with myself and others, will champion in the future changes to our healthcare system so that we could take better care of individuals. And so now, one of the things that really I wanted to share with you is how has this impacted various communities? In particular, how has it impacted the Latinx community? So this is data from the CDC. And so when you compare white, non-Hispanic persons to these other minority groups, you could kind of see the data. It's very impactful, right? So you look at cases, so more than 2 times the cases in Latinx communities, more than 4 times the hospitalizations, and unfortunately up to 3 times more deaths amongst these community members. So yes, this was a virus that was hurting a lot of individuals over a certain age, but also a lot of individuals that are succumbing to this were younger and unfortunately happened to be minority. And so this was really impactful and concerning to all of us, especially those of us who've been working and caring for these communities. So what about here in California? So we looked at the CDC data, so let's look at California a bit more, right? So there's definitely some disproportionate impacts associated with COVID-19. So the Latinx community makes up about 39, oops, hold on a second. The Latinx community makes up about 39% of the Latino, made up 39% of Latinos or Latinx, but of all the COVID cases and all the deaths, this is probably the most impactful. 59% of COVID cases are Latinx, and 46% of the deaths are associated with that community. So really disheartening. Closer to home, what does Orange County look like? So Latinx makes up about 35% of the entire county, but yet 46% of all the cases here in the county are impacting the Latinx community. So, you know, it's holding true to form, just like the CDC data, just like California's data, and of course the deaths amongst the community is about 38%. So extremely, extremely impactful. So this county is one of the smaller counties in the state. It's densely populated in certain cities. So which cities are those? The cities that are real densely populated, which the majority of the Orange County community lives in, is in Anaheim and Santa Ana. And it should be no surprise of what I'm telling you today, that the majority of the folks that live in these communities are of Latinx background, are of Latinx descent. And so, you know, when we were dealing with this early on, and this is a very interesting photo on the screen, those circles represented number of cases. And so early on, further south in Orange County, there were hardly any blips there. And so individuals were probably thinking, well, this pandemic isn't hurting me or is not reaching me. Where are all the cases? I see it on the news, I hear about it, but yet they were not directly being impacted. Why? Because the densely populated cities that were being dramatically impacted were the cities of Santa Ana and Anaheim. And so the majority of the cases, the majority of deaths have occurred within these communities. So why is this? Why is this happening? So this is a bigger issue, right? This isn't something that just started due to the pandemic. We know that the individuals impacted by the pandemic are socioeconomically disadvantaged or have really some challenges where they are struggling either with access to care, access to resources financially that will raise them out of poverty. And so when you look at the city of Anaheim and Santa Ana, most of the people living in here, they're living in densely populated areas, they're living in apartment complexes, there's multi-generational people living inside these homes. And so when I diagnose a patient, one of our specific patients, that they have COVID, you know, it's really hard for them to activate isolation, you know, making sure they're in a room, keeping themselves safe away from family members. Why? Because they probably may be sharing a room, or they might just have one bathroom to utilize it for the entire family. So these are really important issues that were impacting these communities. The other thing that's really apparent within these two cities is because of the poverty level, they do not have access to health care as easily. And so that in of itself causes more challenges. So what does it cause? It causes them to have more chronic diseases that are likely less controlled, and therefore puts them at even higher risk for being admitted to hospitals and actually succumbing to this infection, right? We've heard all those high-risk conditions that put folks at risk from dying or getting admitted in intensive care units. Well, unfortunately, the community that we serve, the community, particularly the Latinx community, have higher levels of chronic disease and more likely to be uncontrolled in those chronic diseases. So again, very, very impactful. The other thing that's really important, and so when we look at this in a different lens, these are the concepts of social determinants of health, right? So what is social determinants of health? These are the places where people live, work, play, or the environment in which they are raised and grow up that directly impact their overall health outcomes. And most individuals, poor communities and communities of color, tend to live in communities that don't have the same resources or the same types of education or work that allows them to stay safe during this time. And so what did we talk about a lot? Essential workers, right? So a lot of attention was placed early on healthcare workers being essential, but then as we started to transition, who were the people that allowed us to continue to really, frankly, survive, right? Essential workers working in the food industry, in supermarkets, in the agricultural industry, in construction, in deliveries. These individuals predominantly were of Latinx or other minority communities who were there working on the ground. And we know, unfortunately, early on, many people, and even to this day, do not adhere to social distancing, wearing masks. And so these folks were definitely getting exposed within their workplace because they didn't have the ability to protect themselves as well. Frankly, because maybe someone wouldn't even put on a mask. And so the other thing that's really impactful during all this time is think about this for a moment. The U.S. Bureau of Labor Statistics says only 16% of Latinx actually can work remotely from home. 16%. That data comes back from 2018. That is extremely impactful because, again, they're essential. They have to go into work. Take it a step further. They're working in positions, they're in certain workforces that may not have great sick leave. They may not even get paid for sick leave. So they have to make the decision, do I go to work, receive income so I can support my family at home, or do I stay home and run the risk of not keeping the lights on, not being able to provide to our family? And so those are the struggles that our community, and particularly our patients here at our Federally Qualified Health Center, have really struggled with. And so as we look towards how did we address it, really becoming very innovative of how we addressed it, not only dealing with their medical conditions and, of course, giving them guidance on their COVID diagnoses, but what were the other resources we could offer them? So many federally qualified health centers, including ours, have social workers on the ground that really were working aggressively to provide resources, everything from food security to rent assistance, even to help them find government-sponsored housing so that they could carefully isolate themselves away from their families and not further impact their home. And so all these things were actively occurring. But one of the biggest challenges, again, is as an essential worker, they don't have the ability, they do not have the ability to work remote, unlike other communities and other folks in this county and across the country. So really, really impactful. So now that we have this vaccine, there's been a lot of debate. There's been a lot of debate who gets to the front of the line, who should get the vaccine, various tiers. Every state has done something different. Now, here in California, there's definitely changes in tiers, as you heard, as of this past Monday. Everyone over the age of 16 who have chronic diseases can have access for the vaccine. The other folks that have already been given access are essential workers, which is a wonderful opportunity. And the other folks have all, that we are aware of are healthcare workers. So what vaccines are out there, right? So what are our options? So we hear a lot about various vaccines. So let's concentrate more on the left side of the screen, where we'll see the vaccines that may sound familiar to you. So there's viral vector vaccines and there's RNA vaccines. So these vaccines provide instructions to our body cells and tell it to produce specifically the spike protein for the COVID-19 virus. And so the minute this protein is produced, our body recognizes it as not being human, and automatically our immune system starts fighting it off. It brings its friends along, and it says, remember that this is foreign, and get ready when this potential infection comes our way again. And so quickly that genetic code gets dissolved and deleted. It gets removed from our body, as well as the spike protein. And so all that we're left with is our immune system just floating around, waiting, preparing to fight off this infection. At no point does this genetic information, coalesce or get implanted in our own DNA. It doesn't work that way. And the other thing that most folks or some of our patients tend to worry about is, can it cause all these other issues? Can it travel somewhere and impact my reproductive organs? Absolutely not. It sits in your muscle cells, in your arms, and that's where it does everything it needs to take care of. And so when we look at the vaccines, this is just another illustration of what it looks like, and underneath the various ones, right? So there's the genetic code vaccines, there are the viral vectors, subunit vaccines, and then they're weakened or inactivated vaccines. So you can see under them the various vaccines that are out and about with regards to COVID. So in the United States, the top 3 have been officially given emergency use authorization. So what does EUA, or emergency use authorization, even mean? So it doesn't have full approval from the FDA, but what it has been able to grant these is that they've gone through all the specific phases in vaccine evaluation. So phase 1, 2, and 3 trials. They've demonstrated efficacy, they've demonstrated safety, and they've demonstrated that they are producing protection. And so when we give them emergency use authorization, we've already got enough information to grant approval and move forward with its use. So what did Operation Warp Speed do? So that's another thing most folks wonder, like, oh my gosh, these vaccines came out too fast. Really, you have to appreciate something that's so unique about this time in our lives. Never has all this financial resource poured into the common focus of scientific effort to develop a vaccine. The hardest parts about vaccination trials is 2 things: recruitment of participants, as well as production of the vaccine. And that's where the money was poured into, to ensure that we had a lot of recruitment quickly, as well as mass production, because we had already begun to study these types of vaccines. So the mRNA vaccine, such as the Pfizer, Moderna, that concept has been around for some time. It's been studied in Zika, in rabies, and flu. And so it's really important to understand this is not new necessarily. And so what we allowed us to do with this emergency use authorization, again, put them in circulation. We knew that things were working in such a way that we wanted to have mass production ready once it was approved, so that it could start getting distributed across not only the U.S., but across the world. And so that's what makes us exciting. So what you're looking at the table really is, what I like to talk about Pfizer, Moderna, is that these are twin vaccines. These vaccines are identical. In science, the best thing we want to see is an independent research study duplicate the exact same thing, and almost perfectly, if you look at it, efficacy just by 1% difference between those two. They're mRNA, they're 2 doses, they have the same efficacy, the trial size was almost just as large, they're definitely protecting against variants. The difference between Pfizer and Moderna is that they were tested in age groups slightly different, but the most important thing is that efficacy came out slightly after the second dose. So you needed to get 2 doses to get that protection, as opposed to the Janssen vaccine or the J&J vaccine, the Johnson & Johnson vaccine. That's a different type of vaccine. And what's really important to appreciate is, most people start talking, and you've heard this, I'm sure you've heard this, that maybe the J&J isn't as good, or it's not as good as the mRNA vaccines. Let me be very clear. The timing of study of the mRNA vaccines of Pfizer Moderna was at a different point in time than the J&J vaccine. The J&J vaccine was studied in Latin America, the U.S., and South Africa during the peak of pandemic. And so what do we know was happening? There were already variants circulating in these various continents, in these areas, in these countries. And so it was really important to appreciate that. So it shouldn't surprise us that the efficacy was lower in the J&J vaccine, okay? We do know that it's also effective in the South African virus, but again, we have to really appreciate it. It isn't an apples-to-apples comparison. This is a very different vaccine versus the mRNA vaccine, okay? So the nice thing is we now have 3 options to help the entire U.S., and if many of you heard the president speak a few days ago, there will be enough vaccine for everyone to have access to, hopefully by May. So that is exactly what we're going to be looking at. So let's talk a little bit more about variants, because we hear about this. The news likes to scare us. Everybody likes to really talk about, oh my gosh, there was a Brazilian variant just documented here in California. What should we do now? And so let's take a step back and appreciate what is it that a virus does. So for those of you who have the pleasure of learning about viruses or haven't, here's what we simply have to remember, right? Viruses, their simple job is to find a host and replicate. So the more they replicate, the likelihood that they're going to change and mutate. That is what they do. This isn't anything that we should be surprised of. So let's use an example, right? How many of you have had a cold, right? How many have you had a cold virus? You've gotten sick, and then maybe a few weeks later, you get another cold. Well, guess what? It's not that you got the same virus, you just got a different version of it, right? Because it was circulating, it was replicating, and someone else had a different version of the cold that gave it to you. So with regards to the variants, yes, there's variants. There's been a California variant for some time. It's just, again, something we have to appreciate. During the second wave, the second peak, the California variant was the predominant variant and still is the predominant variant here, okay? So the nice thing is that we could appreciate at least the mRNA vaccines definitely are doing a good job of combating the variants, okay? And so they've literally taken blood samples from people who've been vaccinated, put it on a petri dish, and seen that it can eliminate and kill the various variants that are circulating. To give you a more close-to-home example, here at UCI Health, we vaccinated pretty much all of our healthcare worker team. And so we were doing random asymptomatic testing for COVID-19. And so as we started to vaccinate our staff, we started to see that positivity rate start coming down. And so we were proving the science that, yes, our vaccination rates were increasing, our staff were getting protected, and they were not turning positive in this randomized testing. And so with comfort and confidence, I can tell you that the vaccine was working, and it was working definitely against what we know was circulating here in Orange County, which is predominantly the California variant. So all good things, but the key takeaway from all this is, yes, we know there are variants. We have to get vaccinated. The sooner we get vaccinated, the more likely we'll stop the circulation of this virus and subsequently protect ourselves and our loved ones. So who should get vaccinated? At the end of the day, there's lots of things that are changing, right? We know kids are currently being studied. They're not eligible to be getting vaccinated, but all adults who do not have a serious allergy to the vaccine should get vaccinated. Those who have had COVID in the past should absolutely get vaccinated. This is probably one of the biggest questions I get. Dr. Mayorga, I've gotten COVID-19. Debo de ponerme la vacuna. Absolutely get the vaccine. Our immune system, our natural immune system, isn't as good as it would be in response to the vaccine. Okay, so remember, if I get COVID-19 before I got vaccinated, my immune system throws everything in the kitchen sink at it. It's trying to produce everything to fight off the infection. And so sometimes it doesn't get it perfect, but it does what it needs to do. And so now if I get the vaccine, I've programmed my immune system to focus all its effort and energy to defend me against that spike protein, that COVID-19 virus. So absolutely, you want to get the same protection as what was proven in the studies. We've talked about broad availability, hopefully come May, but I suspect it may be even sooner than that. So hopefully that'll occur. Here in Orange County, these are the phases that are actively being vaccinated. Studies for children have officially begun. I just heard this morning that Moderna has actually begun to test in children over 6 months to 12 years of age. So that is coming. We suspect those results will probably not be available for the new academic year, but we'll see what the data shows. So the other question is, should we wait? There's a lot of people, gosh, this is a new vaccine. I don't know. I'm not certain. Well, hey, the real heroes in all this were the people that signed up for the vaccine trials, right? That was about 70,000 people just between Moderna and Pfizer. And so, okay, you want to wait. You wanted to wait back then. So now, there's over 70 million people in the U.S. vaccinated. I just showed you the stat across the entire world. What are we waiting for? Now is the time, right? Let's get vaccinated. Let's put an end to this. Let's get to that herd immunity, because we do not want to get this infection. I don't know how this infection will impact you versus the person sitting next to you or your loved one. I have no idea. We've heard of people die of this virus, unfortunately, who are super young, but we just don't know. Why take the risk? What you know for sure is the vaccine is going to give you the protection you need. Can it make you sick? This is a classic vaccine, right? It's just like any other vaccine that we tend to get, such as the flu vaccine and others. You're going to get side effects. That's a normal immune response. Be excited. If you get those reactions or that side effect specifically, that means your body is working. That means it's producing the defenses. We're definitely seeing that within the first 24 hours if you're going to get it and it goes away fairly quickly. You could definitely take medications after the fact you get the vaccine. Do not pre-medicate, because that pre-medication may blunt your immune response. We don't want to do that, right? We want your body to develop the full amount of immune response as possible. So don't take anything before you get the shot, unless you've already taken these medications due to your doctor's orders. And so, can we stop masking? Because this is the other one, right? We're seeing tiers changing. The red tier, people were at the movie theaters yesterday. They're going to indoor dining. Why should we not? Absolutely not stop masking, right? There's nothing magical about walking into a restaurant right now and the virus just stops at the door, right? Like, there's this magic thinking that I'm going to walk into a restaurant and I can take my mask off. What is the highest risk activity that you could do in getting this is being in an enclosed setting without your mask on, all right? And so be very mindful. Anyone who's at risk still to get this infection are those who have yet to get the vaccine. So no matter your age, if you haven't gotten the vaccine, you're at increased risk. So do things cautiously. Wear your mask, keep your distance. If you want to socialize, be mindful of it, right? We know that good ventilation works. We know that all the public health, guidelines still work. But please, we cannot stop masking at this point because we haven't achieved herd immunity. We need 70 to 85% of the entire population here in the U.S. to get vaccinated, right? And that data comes from how infectious I could be. How many people can I infect with COVID if I have it? So it's roughly about 5, and that's where that number comes from. That's 70 to 85%, okay? So really keep that in mind. We don't want folks to get this infection. We'd rather you get protected, so be mindful when you do that. So until further notice, we still have to wear masks. You'll probably hear that for a little bit more as we move on. Lastly, and then we'll jump into questions. I have allergies. Should I get it? Look, at the end Allergies are very specific. They're specific to certain things. So if you have a peanut allergy, that doesn't mean you're going to have an egg allergy. That doesn't mean you're going to have an allergy to the vaccine, okay? The other thing that's really important, because people are like, well, was this made in chickens or how does it? No, these were not. These are manufactured in a lab, so they're very basic. All that's in there is water and the various components and salt, okay? There's nothing more than that. That's what makes some of these vaccines, specifically the mRNA vaccine, so unique, because they can mass produce it and modify it as needed. People worry about anaphylaxis, which is the most severe allergic reaction you could have. The original data showed that 11 out of a million people were getting anaphylaxis. That data has been revised. It's less. It's 5. So for every million people receiving a vaccine, there's likely that a little less than 5 people may have an anaphylactic reaction. How does that compare to penicillin? There it is right there. Many of us have used penicillin. Anaphylaxis is higher risk in penicillin. It's 1 in 5,000. So just, again, comparing things, put things in perspective. At this point, no one has died from this vaccine. Of course, the media loves to talk about this. They're trying to find those stories, but there's no documented evidence that people have died from an anaphylactic reaction due to this, nor has actually been documented that someone's died from the vaccine here in the United States. So please be mindful when you see that on the TV. You should always question if that's really accurate or not. Let the science evaluate the situation, okay? And so lastly, I think it's important with anything we do, specifically for yourselves, for your loved ones, and for all the communities, especially our minority communities, education, outreach is absolutely key to prevent this infection. We want to be able to do that because we want to respond and recover well, but more importantly, reimagine how we deliver healthcare. As I shared with you, this pandemic has exposed the healthcare disparities that impact the poorest communities, and we are judged on how well we take care of them. So hopefully you could help me take care of them and champion for people getting vaccinated and also breaking that disparity in healthcare. I'll stop there. Thank you so much. I'm excited to answer any questions at the moment.
Dr. Mayorga, we had a question sent in through email from Debbie, and she says that one of the biggest vaccination centers in OC was in one of the hardest hit areas, which is Anaheim. One of the concerns I've had regarding the Latinx community is getting vaccinations, is that they would be unable to schedule a vaccination due to their work schedules. So in other words, a time problem rather than a proximity problem, since the population is more vulnerable due to their high representation in service industry jobs. What do you think would help to get the vaccinations to the population faster?
So a lot of efforts are being done across the county in collaboration with other non-for-profits, including community health centers like the one that I oversee here at UCI. And so these centers, along with community partners, are really focusing on that population. In particular, this week, which is great, I'd love to share, this week, 4 other partners, including ourselves, have worked to vaccinate essential workers at our Anaheim location, specifically those working in the food industry, in the large supermarket, and seeing the faces of excitement, a little nervous, but excited to get the vaccine was great. So I am absolutely concerned the mechanism of how we're registering for this vaccine. The internet and app literacy amongst the hardest hit community is very poor. And so we need to advocate and really help. Everything from a grassroots perspective, I personally know both friends, including myself, that I literally help people sign up, right? We've literally sat on web pages, refreshing, trying to get people signed up. That's the basic thing you could do. If you have loved ones that are eligible and don't feel comfortable with the internet, take the opportunity to help. You should definitely do that. It is an extreme challenge, but we're all working together to try to address it.
Thank you so much for answering that. Do you think that call banks could help, that are Spanish language capable?
Yeah, no, great. We do. I think call banks absolutely work. I know the School of Public Health at UCI have been doing that. They originally were doing it more as a like FAQ, answer questions about COVID. I think they're now pivoted over to talking about the vaccine. Here at UCI Health, we've had 2,000 65-year and older. We called every single one of them up to like 5 to 6 times. And so I'm very proud to say that we're at about 65 to 68% of them almost fully vaccinated. So it's a huge lift, and I think that's the underappreciation of how much effort. It's not. I don't think it's an access thing anymore. People want to get vaccinated. They just want the help to get registered. Registration to me is going to be the biggest obstacle. And so wherever you could lend a hand there, even if it's just your neighbors or your loved ones, do it. That's the most important thing.
Thank you so much for that answer.
So first of all, thank you so much, Dr. Mayorga. Your presentation was wonderful. I just have one question. Now, you mentioned that the vaccines do offer some protection towards the variants, but what if we get to this point where the virus evolves to the point it excuses our vaccines completely? Because what we see with the influenza is we kind of have like this quote unquote break, and the scientists can kind of tinker the vaccine for the next seasonal epidemic or influenza season. However, if we juxtapose this with the COVID-19 vaccine or the COVID-19, we can see that this virus is not seasonal. So in your opinion, what's going on? What can we do to help?
Yeah, so first of all, the coronavirus family is a classic family that is seasonal. This infection is acting seasonal. So let's not fool ourselves and think that it's not coming back in late fall, early winter. It absolutely will. This is why we're making a push to vaccinate as many people as possible, because the hardest hit communities are going to be those that didn't get access to that. Okay, so that's number one. Number two is we have to appreciate. Let me kind of give you the flu vaccine analogy for a second. You all remember swine flu, right? H1N1. It was a big deal. It was going to be a pandemic, but we actually curtailed it. We designed the flu vaccine so that it would protect us. And for the last 5 to 7 years, the flu variant that's been prominent has been the swine flu. It's been H1N1. And you don't hear that it's really impacted us, right? Why is that? Because every year we get the vaccine, every year we boost our immunity, and so we're curtailing it. As a matter of fact, this year, with all the social distancing, hand hygiene, and masking, cases of flu are negligible, and there's another really important virus that's been really negligible that impacts newborns and babies. Absolutely, we're super excited. We've proven basic public health works. My suspicion is that we will likely need this vaccine on a yearly basis. And the nice thing is there's opportunity. The way the design vaccines are is that we could modify them so that we could stay at least in lock and step with variants and its changes. So it's going to be it's a lot quicker than producing the flu vaccine, for example.
What happens if people are immunocompromised? Can people who are that have weak immune systems, because as we can see, what we want is a strong immune response, and that's why we get all these side effects. But what about people whose immune systems are naturally weakened, or maybe they're taking immunosuppressants, maybe they got an organ transplant? Is there a vaccine that you recommend, or should they get vaccinated? What should they do?
Yeah. First of all, it's important for these individuals to speak to their doctors about getting vaccinated. Now, we absolutely want people who are immune compromised to get vaccinated. As a matter of fact, a lot of our cancer patients are getting vaccinated as we speak. And so any immune response is a good response, right? So if I tell you that a perfect healthy person gets 95% effect and protection after getting the mRNA vaccines. Well, so an immune suppressed person gets 65 or 75. I don't know that the data is there yet, but that's absolutely still better. Let's not forget this for a moment. The FDA was willing to approve anything that was protecting us 50%. All these vaccines are doing that. They're better than what the FDA was going to approve.
Now, I think this is a question that all of us have. Are these vaccines free? I think that's something that's been really prominent, at least in the Latinx community. Is this fear of people who are undocumented? People who are undocumented are afraid of going to these vaccine sites because they think that potentially ICE is going to be there, or that they're being at risk of, having information taken or something like that. What do you say to these people? Should they be afraid?
So first and foremost, anyone that wants the vaccine is eligible to get the vaccine. It's free. Anyone that gets approached or told that if you pay X dollar amount you'll get the vaccine, that is absolutely against the law. That is a huge offense that you could get in trouble with. So the vaccine is free to anyone, no matter of their legal status. It is absolutely imperative people know that. And it will remain available to anyone so long as the public health emergency is in effect and the federal government says that it's available in that fashion. And so that's the main focus behind that. I think there's really important things that, the prior administration really had, left many people concerned that they were not being cared for, that they shouldn't be here. So I could completely understand. So there's a different administration now. There's always been this effort to really make sure that we protect everyone, because in the end, the more people we protect, the less likely this is going to hurt us.
Is reinfection still possible even when we're vaccinated? Because these vaccines aren't, or any vaccine for that matter, they aren't 100% efficacious. So is there still a possibility of being reinfected, and maybe being reinfected from different strains of the virus too?
Yeah, so none of the vaccines are 100% protective. What we do know is the vaccines definitely will protect you. This is the most important part of the vaccines. All the vaccines have shown this that are currently approved in the U.S. The moderate to severe cases that end up folks in the intensive care unit and even die from them, that's what we wanted the vaccines to prevent. And that is exactly what's been demonstrated in the studies. So even if you do get sick from COVID and you've gotten the vaccine, it's probably going to be a mild case. It definitely means you could transmit it, right, if you end up getting it. But at the end of the day, the moderate to severe hospitalizations and deaths have been reduced dramatically by these vaccines, and that's what we want vaccines to do. So I think there was a question in the chat about, can people who got vaccinated get it if they're with other folks who haven't? Yeah, you can, right? I mean, you have to remember. So, this is why the CDC has kind of shared recently, you could gather with other folks who've been vaccinated, even indoors. But again, just be mindful of that. I'm a big fan of, we live in Southern California, so the weather's reasonable. We could sit inside a room with people who've been vaccinated with good ventilation, right? Of course, being outside is a lot safer, but I think it's important just to kind of really use common sense when it comes to certain things, when it comes to gatherings or anything of that nature.
Sorry, Vita. Brianna had a really great question in the chat. She said, do you have a site or any kind of way that has to debunk the COVID vaccine myths in a digestible way that's available in Spanish? Because I've only seen good ones in English. So just how do we help family members or members of our own community who only speak Spanish? How do we explain to them and debunk these myths that we've seen on Facebook and the news and stuff?
Yeah, I think so UCI Health has a website that's public, So if you go to the UCI Health vaccine webpage, I'll send it to you guys. I can't type it up fast enough, but so that you could share. It has the English as well as the Spanish version of vaccine FAQs. It's 30 to 35 of the most popular questions, including ones that I've heard, such as like, can you get cancer? Does this cause infertility? Is there a microchip in there? And I've personally been involved in that translation. So definitely it's a great resource, and it comes from a trusted institution, right? Your school, right? So I think it'd be great to start there. Of course, the Orange County Healthcare Agency has multiple languages of FAQs. You're welcome to go there as well. I think they have them more than just Spanish. They have them in Vietnamese and other languages. And I'm sorry, things are cutting real quick on the chat. So any other things?
Dennis asked, can you tell us more about the California variant, transmissivity, fatality rates, prevalence?
Yeah, so we're still studying that quite a bit. What I can tell you is that although you haven't seen this public, I can tell you our experts have definitely here at UCI can say that the predominant variant in Orange County was the California variant during the peak. Okay, and so the reason why I shared earlier the overall performance of our vaccination efforts for our staff, because we are working in the highest risk area, right? We were taking care of these patients with COVID, and so the fact that they were getting vaccinated tells me that this vaccine works against that variant, and they did not get sick. So I think it's a really, really important point. Yes, the transmissibility is there. I just can't tell you the fatality association to what would the original or the novel COVID-19, but I could comfortably tell you that the vaccine's working, especially amongst healthcare workers who were taking care of the sickest patients walking in the door here at UCI Health.
Dr. Mayorga, to piggyback on that, Christina unmuted herself, so you can go ahead and ask Christina.
Hi, Dr. Mayorga. Thank you for this space. I come as a staff at UCI, but also a concerned child. So my mom is 64 with pre-existing conditions, and it's been difficult, right? She's also uninsured, unemployed, undocumented. So the intersectionality of this process has been a journey for us, right, for the last year. So my concern now is that my understanding is for pre-existing conditions, the vaccine rollout was going to be primarily through the primary doctor, which is very concerning because uninsured, undocumented, unemployed folks usually don't have a primary doctor. So now I am wondering what is the rollout going to be for folks like my mom? And I see the pharmacies are still not taking these types of appointments also. So I'm not sure if there's specific regulations right now, or if there's any type of protocol that's being identified for categories like the one I just mentioned.
Sure. And so first of all, your mom absolutely needs a doctor, so she should definitely find the closest fairly qualified health center, also known as community health, near your home or her home. I would say, let's keep in mind, those organizations, they've been in place since the mid-1970s. We provide care even if people don't have the ability to pay, and also if they don't have legal status here. We never ask that. It's the best kept secret when it comes to the federal government. Believe it or not, they fund these organizations, and our role is to serve the work and serve the most medically underserved areas in the country. And so you find the nearest one. UCI has one. That's the one I oversee. Your mom is more than welcome to become one of our patients, and be sure to help her get the vaccine.
We've been blessed.
So in that regard.
Yeah, we've been blessed. We've been blessed that she's been part of Listonic.
Oh yeah.
And State of Orange for I don't know how since basically she was diagnosed for like over 15 years. But I called them and I asked if they were going to be administering the vaccine. And using all the social capital that I could muster, I'm like, hi, are you going to be administering? And they said they wouldn't. So that's also, or maybe things have changed since then.
I think it was probably the timing when you called.
Okay.
You remember yesterday, the state as well as the county officially dropped the age down to 16 and over with chronic medical conditions. So your mom is officially eligible for vaccination.
Okay.
So I would call them back
Okay.
because Latinx is administering the vaccine, and so is the other QHCs across this county.
Okay, so it would go through them. Okay, I really appreciate that. I know it only happened yesterday, but you know, in our hearts is an attorney, so I'm eager.
Oh,
I'm
no, I get
excited.
it.
Thank you so much. I really
Yeah.
appreciate your comments.
You're welcome. Other questions? I know we're running out of time.
Actually, I had one question. You know, a lot of folks early on who were diagnosed with COVID-19 in March of last year, they were diagnosed by their doctors, but because the testing was so scarce at the time, they weren't allowed to get tested. So I have family members and colleagues who were never officially tested, but by their, doctor's evaluation were confirmed to have COVID. And so are those numbers included in the statistics? Will they ever be included in the statistics? Like, will there be any documentation where people can self-identify, I had COVID, but I was never tested?
You know what? I don't know the answer to that, but what I do know is that there are ways you could test for the antibody, and that data is being tracked. The dean of the School of Public Health at UCI was originally tasked to assess the overall prevalence of COVID-19 in the hardest hit areas, and she actually had some great data to come out. These were exactly those individuals that didn't have access, but we found that they were positive, so they previously had it, and thankfully didn't succumb to it. So I think absolutely there's ways you can get tested for the antibody to see if you have it. Now, the antibody doesn't necessarily mean you have full protection, right? We've already had that conversation just a minute ago. But also the antibody may wane too. So there's just some questionable things about how long in your body your immune system is protecting you from COVID, especially if you haven't had the vaccine. So we still don't know that very well. But what we do know is if you do get vaccinated, you'll get that protection that's documented in the studies. Yeah.
Claudia, did you have a question?
No.
Okay, I saw you turn on your camera, so I was like, maybe you had a question. Another question I had in one of your slides, a lot of things that people are talking about is the high vaccination rate in Israel, right? And so not wanting to get into politics too much, but do we know, does that include the Palestinian community? Like what, because they're really flaunting this statistic, but is that really everybody in that area of the world?
I just heard yesterday on NPR a segment on this. They were talking about Israel and the Palestinians. I didn't catch the full story, but I encourage you to listen to it. It did come out yesterday. My suspicion is that, at least what I caught, they tried to include it, they were offering it. I think that was a great gesture, honestly. I think it was wonderful to hear that they were trying to offer the vaccine. Originally, Palestine was not necessarily wanting the help, but yeah, I encourage you to go back and listen to it. But I'm not sure if it's including them. What I do know is that I believe they use one type of mRNA vaccine, and so that's why the data that's coming from there is so impressive, because at the end they've vaccinated quite a few people, and that volume of individuals now protected really gives us a lot of insight about what's going on with this vaccine and the protection it gives.
Okay, I think that concludes our time. I know Dr. Mayorga is a busy person, but we just want to thank you for lending your time for us today, especially now with the vaccine rollout. It's very exciting. It's very hopeful. I got my dose like 2 weeks ago, so I'm so excited, and it feels amazing after a whole year of being in this to finally see some glimmer of hope. So thank you for answering our questions and for your great presentation. We really appreciate it.
You're all very welcome. It's an honor and privilege. Thank you so much. Again, this is kind of why I came back, was to really get a chance to speak to all of you and really encourage you all to help me, right? Help me and the rest of my team, you know, elevate our community and really educate more than anything else, whatever you so choose, either in healthcare or anything that you do. So thank you so much. And I hope that this has been enjoyable for folks.
Thank you. Have a good rest of your day,
Bye-bye.
everybody. Thank you.
Thank you.
Thank you.